Welcome to Pregnant in the Netherlands, your guide to pregnancy, birth, and beyond. I'm Juliana, a birth doula and a childbirth educator.
And I'm Anna, a doula, childbirth educator, and lactation counselor. We're here to support you with evidence-based information and honest conversations that help you feel confident, informed, and empowered throughout your pregnancy, birth, and postpartum journey in the Netherlands.
Hey Anna, good morning.
Good morning. How are you doing?
Yeah, I just had a good cry this morning already. I have a beautiful book with me. I was really planning to buy this book since August last year, so I got it yesterday, and I'm just so happy I did because I know the illustrator of the book, and I knew that she makes beautiful illustrations.
Oh, nice.
And that just adds them to the story. The title is My Sister is an Angel. So I think you probably already know what is this story about. And if you can read Dutch, I think it's really worth reading this book.
Oh, nice. Even if you don't read Dutch, you can get it for the beautiful illustrations.
Yeah, that's true. So it was a good start of the day.
Oh, yeah.
And how are you?
Doing well. Excited to get into our topic today.
Yes, and that is breech presentation.
If you haven't heard of breech, we can define it as the baby. Well, I can't organize my thoughts.
In a simple way is normally, in a normal presentation, the head is down, and in a breech presentation, the buttocks or the legs are down, pointing downwards instead of up.
Yeah, and it's not terribly common. It's like 3 to 4% of full-term births are end up being breech presentation.
Yeah. And don't do the same mistake what I did, because I was like 32 weeks, 33 weeks pregnant, and I read in a book that by now your baby already turned head down, and I was just like, oh no, I had the appointment with the midwife a few days ago, and she was still with the head up, and I made myself completely crazy, and so I was so worried about it. And the next time, I think a week later, when I had the ultrasound, she was just head down. So I was stressed for nothing. So it's completely normal to have a baby in whatever position at week 32, 33, even 34 is okay. It can be still the case that they would turn.
Yeah. So before the end of pregnancy, they're really just floating around, doing somersaults. But then as they get bigger and their space gets smaller, then they tend to turn head down. And that usually happens before 36 weeks.
Yes.
And if it hasn't happened by 36 weeks, then it's kind of considered a breech presentation.
Yeah. Officially, it's 35 weeks in the Netherlands when your midwife can say, okay, the baby is in breech position. So then they are going to ask you to make an appointment at the hospital. And once you go to the hospital, so between week 35 and 36, they are going to check if it's still the case, if it's really the case that the baby is with the head up instead of head down. And then you have a consultation for what to do. What are the options in this situation?
Yeah. And what are the options here in the Netherlands?
There is an option, it's called the ECV, the external cephalic version. So, or shortly just version, when they manually turn the baby with the head down. So that's one option, of course, to try. Another option could be also try to give birth vaginally like that. Not all the hospitals are able to support you in that, but some hospitals are.
Yeah, I'm sure that that's kind of surprising for people. I mean, coming from the US, fewer and fewer providers feel comfortable or have the experience to help deliver a breech baby. And so it's kind of an automatic cesarean in the US if you have a breech baby, unless you find a very specialized provider who's willing to help you give birth vaginally.
And indeed, that's the third option, the cesarean.
So it is really nice that here in the Netherlands, again, you have a nice range of choices that you're supported. If you want to give birth, try to give birth vaginally with a breech baby, finding a hospital that supports that, giving birth by cesarean, or also trying to turn the baby before giving birth.
Yes. And do we want to talk about different breech presentations?
Yeah, I think that we can go into that.
Yeah. So there's the frank breech, when the legs are extended up along the body. Yeah.
Yes. Yes, thank you for the demonstration.
And then we have the complete breech, when the hips and the knees are flexed and the feet are near the buttocks. And there is the incomplete breech, when one leg is extended up, like in the frank breech, but the other leg is flexed down, like the complete breech. And then there's the footling breech. That means that one or both legs are down, extended down, and that one or both feet are under the buttocks.
And that's the part that comes out first.
Yeah, it looks pretty interesting if you see birth videos.
Yes.
There is a foot and a leg coming out. Like,
Yeah,
you
for
want to
sure.
run immediately.
Yeah.
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 So once the midwife determined that your baby is indeed in breech position, as I said, you have a consultation at the hospital. When you go there, and then they are going to check if it's still the case, and they are also going to check the heart rate of the baby. So you have for like half an hour or longer continuous heart rate monitoring, and also checking if there is any activity in the uterus. And then afterwards, you have a conversation with a midwife, with a clinical midwife, about your options. You also get like a leaflet, a brochure about what are the options, what can happen, how does the external version work, and the other options we already talked about, if it's possible to deliver vaginally or not in the hospital, and there would be C-section. If you decide to go for a version, then they are going to make an appointment to actually come for the external version. I know that, for example, in Maxima Hospital, there are 3 gynecologists who are experienced and expert team. So one of them would do the version. Once you go for the appointment to actually do the version, then they are going to listen to the heartbeat again. They are going to check with ultrasound if it's still the case, and check how exactly the baby is positioned. And if everything is, and they are also going to check the amniotic fluid. And once it looks all good and you agree, and then they are going to try version. So the first attempt is going to be without medication. With one hand, the gynecologist is going to grab the butt of the baby, and with the other hand, the head of the baby. And then slowly but firmly, they are going to try to turn the baby to the right position. And then probably there is a nurse or someone else who is helping them to keep the baby in the position while they are doing the movement, the attempt. And it's like maximum a minute, so it's really quick. Most women find it uncomfortable, not necessarily painful, but are you still here? Anna, I lost you. I hope you will be back. I will just go on. So most women find it a bit uncomfortable, not necessarily painful. But if you experience pain, then they are going to ask you to tell them and stop. A few weeks ago, one of my clients had a a Breech presentation, so she decided to try the external version. She was really we prepared before that she would just concentrate on her breathing, like how we prepared already during contractions. So she did that, and she did it really so perfect. Yeah, she closed her eyes and was just breathing slowly, and within like 30 seconds, it was done. So she couldn't believe it. She was like, "Oh, I thought that you would just get started." But it was already done. And it was successful in her case. So we were super happy. And she was like, "Hey, I just went on. I didn't know if you would come back."
I have no idea what is going on with my internet.
We are still recording, just went
Okay.
on. And I just explained how it was. I also wanted to mention that the first they always try without medication, and when it's not successful without medication, then they might administer a tocolytics, which is helping the uterus to relax, and that's also called, I think, is the medication that's used to suppress preterm labor, like the anti-contraction medication. In this case, with my client, it was not necessary because they could already do it without medication. But I heard that if the first attempt is not successful, then they might try it with the medication. And when it's done, then they are going to check with the ultrasound again. And then you have again at least half an hour, but usually somewhat longer, monitoring to check if the heart rate of the baby okay. Sometimes it drops a bit, so it's a bit lower, but then it should recover. And if the heart rate of the baby is good, if the mother is feeling okay, then they can just go home afterwards. And then the next time when you go to your midwife, and you can even give birth at home after this. So it's really nice that like problem solved and then back to the midwifery care. Yeah, so the midwife with the next appointment is going to see if the baby is still with the head down. And what you can experience afterwards, that you feel that it can be a bit painful on your belly or your abdomen. After this procedure, you might have some, like you feel it on your belly. Soreness, yeah. And you might think, okay, I'm not even supposed to move now because the baby really has to stay like that.
Yeah.
They do it after week 35, always, usually around week 36, 37, because it would be easier to do it before week 35, but then there's also a bigger chance that the baby would turn back. So between week 36 and 37, there's less chance that the baby would turn back. And if the baby turns
then baby
back,
has less space. And
yeah, exactly. And if it still happens, then you can consult again what to do next. You can either try the version again or see what are the next steps for you. And as far as I know, their success rate is around 65-70% for the first time. So it's a pretty good chance.
And that's here in the Netherlands?
Yes.
Nice.
Yeah. And then, of course, you can do a lot of things before that to try. Like when you have your appointment at the hospital, you know already that the baby is in breech position. And there are a lot of exercises, like spinning babies exercises, right?
Yeah. Spinning babies. You can do some acupuncture.
Yeah, you can also look it up on YouTube. I think that's probably the first thing that most women do when they face something like that. We did also with my client with the rebozo, a bit of shaking, and also showed her husband how to do it. So I left my rebozo scarf there with them. They did a lot of things, and they also did acupuncture, and I think that helped her mentally. And also the lady who did the acupuncture, she told her, it's gonna be easy, believe me, they are going to do it, they do the version, and you are gonna be fine. And that was the case. So she believed that it's gonna be like, that's it's easy. It will be successful, and that helps.
So during the version, it's important to really try to relax as much as you can. soften everything. So then the baby has the most amount of space to move around, right? So
Yes.
I'm sure like trying a lot of different things before the version can help you find that relaxation as well, knowing like, okay, we are doing absolutely everything we can to help flip this baby around.
Yes. And it's also important to be able to let it go.
Mm-hmm.
Like, in this case, my client said, I do everything, I try everything I can, but if she's staying like that, there is a reason for that. So then I
Mm-hmm.
accept it. Yeah, before driving yourself crazy about
Mm-hmm.
why is it? Because most of the time you don't really know what the reason is.
Yeah.
Is it the cord that doesn't allow the baby, or is it your pelvis? Yeah, you
Mm-hmm. Or
you
the
probably.
placenta, maybe where the placenta is located, and yeah.
Oh yeah, they are also checking the placenta. I forgot to mention that
Mm-hmm.
in the hospital before they start the procedure. When I lost you, I also explained that she was just breathing, like she used the breathing what we practiced for contractions, and
Mm-hmm.
she was really just closed her eyes and turning inwards and breathing through just how you said it. Really relax everything and let it happen.
Yeah. 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 Oh, that's great that it was a success for her.
Yeah.
So are there any risks with aversion?
Risks. I don't know. Is it a risk if that it's not successful or that the baby turns back again?
Yeah, yeah, definitely.
When you have the follow up appointment and then you see, okay, the baby is in breech position again. Yeah.
Yeah, that can feel probably a little bit defeating.
Yeah. And of course, the a risk can be that the baby's heart rate is not like you see that the baby is not reacting good on the procedure. But it's really
Hmm.
extreme rare cases when the baby's heart rate is low and it stays low after it.
And that's why they monitor for so much before,
Yeah,
during, and after the
yeah,
procedure.
yeah, exactly. Complications can happen always with birth because has its risks itself. But if the gynecologist says that it's safe to do it, then it's probably really safe to do the version.
Hmm.
Also, a risk of complications after version is pretty small.
Small chance of rupturing the membranes, and then placental abruption,
Yeah,
but very, very rare.
indeed.
Do you want to touch on anything else?
I think it's good.
I feel like out of podcast shape, like we haven't done it in, I don't know when our last recording
Yeah.
was, but I'm like, how do we do this again? What are we doing? Did you talk at all about how she went on to have a satisfying vaginal birth?
No, I should, yeah. It was still a long ride for her because she eventually gave birth at 42 weeks and 0 days. She really had to laugh because she was like, yeah, this baby is just doing things her way. Like keeping her parents on their toes all the time. But they had a beautiful vaginal birth in the hospital. It was in the end. She was hoping for home birth, but it was unfortunately not possible. But she really had an empowering birth experience in the end.
That's fantastic. Well, I think that's a nice way to close our ECV episode. Thanks so much for sharing your experience with external cephalic version. We look forward to the next episode.
Yes. Hopefully it won't take so long as this one to arrive in your Spotify or Apple.
Yes.
See you soon.
Take
Bye-bye.
care. Bye.